As a clinician, after you've logged into the system, it becomes very easy for you to go offline. All you have to do is, once you've seen your visits for the day, click on travel mode. The system's automatically going to allow you to travel in and out of the office with or without an internet connection to complete your documentation for that day. You don't have to download any software. You can use the software on a tablet or a laptop or even a mobile phone. And you'll have everything you need right at your fingertips, including the ability to route your day, where we'll give you the directions to your visits. We'll also help you plan out the most efficient trip in order to make the round trip for your daily schedule. You have all of your messages and alerts and communications from the office right here at your fingertips, including the ability to conduct marketing visits, interviews, visits, and tasks are all right available from your dashboard. If you were going to conduct an interview that day, the system automatically gives you the forms that you need to complete that automatically track back to your employee file, to your applicant dashboard, as well as the visits that need to be completed that day, along with the information that you would need to start your visit. Augmented intelligence for us means the ability to eliminate the headaches that are in healthcare. So for instance, if you're driving and you need to contact your patient, you no longer have to look up addresses and phone numbers. You can simply click on the call button, and with our integrated phone system, simply click on the patient's phone number and immediately dial and start talking to your patient. Or if you're running late or need to reschedule your visit, all you have to do is click a button and say, I'm running late, and say you want to send that to your patient and your case manager, and a text message is immediately sent to all the people involved in that in the care for your patient that need to be notified. And finally, we make it very easy for you to actually complete your documentation. So whether you're a nurse, a therapist, a physician, a home health aide, you get this same type of dashboard where you just simply click Begin. And we've tried to make the system as intuitive and easy to use as possible. So from one simple dashboard, you have everything you need to complete your documentation: patient name and contact information, the ability to reschedule your visit, map your visit, supervision forms, authorization reports, lab tests. When you're ready to start your visit, just click on the Start button. The system is smart enough to know that if you're completing an assessment for a Medicare patient, you automatically have to complete your Start a Care Oasis. Or if you're completing a nursing visit assessment for a hospice patient, that you need to complete the hospice information set or an bereavement assessment. The system tracks your mileage and your travel time. It also automatically alerts you to new conditions that may be causing concern for your patient, new additions to the patient's medical record, and any type of risk indicators associated with that patient before you get started. We've attempted to make your assessment as simple as possible. Instead of interfering with the way you conduct your evaluations with your patient, we've made the system incredibly easy to use and completely paperless. You now have the ability to go through your admission documentation right here on the screen and have your patient sign off on consents to photography and video and all of your admission documents that are automatically allocated into the patient's portal so that they have access to that information at any time. We've also rearranged the flow of information so that the system gets out of your way and follows along with the flow of the visit. So instead of having cumbersome labels and text to read through, you have a lot of sliders that just by color coding immediately alert you to problems with the patient's condition. And instead of giving you 1,000 different prompts that you always have to look at and always have to follow along with, the system's smart enough to only give you prompts that are necessary based upon your assessment. So you never have to do extra work, but you always capture the information that's necessary. So based upon the information that you put in, the system will give you additional prompts. Let's look at mobility for an example. As you go through your mobility assessment, we automatically, by color coding, let you know where the problems are with your patient's condition. You have the ability to conduct several different fall risk assessment types. So if you did a timed up and go assessment, for instance, the system's automatically going to let you know if the patient has a high risk for falls. Your integumentary section automatically gives you a body system assessment and flags for wound care information. And based upon the assessment information that you're completing, your OASIS documentation is automatically verified and calculated with you, and is integrated directly into your assessment. Remember that fall risk assessment that we just did, because that plays a small role in how we calculate and help you automate the creation of your care plans. The system automatically is tracking more than 1,200 data points to help you immediately build a care path that justifies and supports medical necessity for the services that you're doing. We have 38 different medical necessity indicators within the software for a skilled nursing document. These are different for therapy versus physicians versus hospitals, but I think the nursing care plan gives you a very good indication of how these data points work and how augmented intelligence is designed to really speed up the creation of your care plan while also protecting you from legal audits or regulatory audits. So for instance, by filling out that fall risk assessment and filling out an assessment based upon your patient's mobility, the system automatically knows that your patient has a fall risk concern and adds that onto your care plan. So when you go to create the care plan, the system also builds the story for you. So instead of an auditor or a surveyor needing to go through all of your documentation and figuring out the data points themselves, we actually convert your assessment into a story for the surveyor automatically. So in this case, in this situation, we're automatically telling the surveyor, putting this on your plan of care and in your documentation, that your patient is at risk for hospitalization due to a fall risk. We automatically put in medical necessity scoring and support. So in this case, it's letting us know that the patient scored an 18, which is a high fall risk on the timed up and go test, and the patient's also taking 2 high-risk medications. It becomes very easy to customize your plan of care based upon the patient's true medical condition. Assessments, instructions, procedures, communications, and goals are all right there at your fingertips. Now, if you were to carry this forward onto an actual plan of care, this is an example of a custom plan of care built out of the software. And you can see that at your fingertips, you immediately have the health history and patient summary that supports all of the interventions that you will be doing during that certification period for that patient. The system automatically creates this narrative for you based upon inpatient history, fall risk assessments, mobility assessments, tracking all of the medical indications and risk factors associated with that assessment and with the interventions that you're going to perform. It automatically gives you vital signs or medical conditions that signify a problem with that patient's condition, new or changed medication that would support medical necessity, new or changed medical conditions that would require teaching or procedures to be performed, as well as complicating factors that give you extra medical justification and pertinent health history facts for that patient. The new plan of care was designed in a way that an auditor or a payer who's trying to approve authorization immediately has at their fingertips the problems that your treatment plan are solving for that patient, showcasing what would happen if your medical interventions were not introduced into that patient's medical care. And that happens, like I said, for more than 1,200 indicators for 38 medical interventions just for skilled nursing alone. Now, after that care path has been created, augmented intelligence effectively keeps all of your nursing staff in compliance from that point on, because when they go to complete their visits, the system automatically tracks the frequency and procedures that need to be performed for that patient on every visit, alerting them based upon priority, previous interventions that have been performed, and upcoming or new conditions with that patient. So for instance, based upon the assessment we just performed, when I go to complete a skilled observation and assessment for the cardiac system, I immediately know what the protocol is that's on the plan of care, which was generated based upon my evaluation. But now all my medical necessity information is also automatically built into the software. So whenever I conduct a skilled observation and assessment, according to most payer guidelines, including Medicare, we have to justify why that skill was necessary in the first place, which is going to be based upon the patient's condition either being currently unstable or that it's stabilizing, but we've had some issues within the past 3 weeks, or that the patient's condition has stabilized, but there still exists some type of complication that requires further observation and assessment. In this case, the system is smart enough to know that the patient still has a currently unstable condition due to edema and peripheral pulses and other cardiac symptoms that were highlighted previously on the assessment within the past 7 days. It automatically tracks complexity of skill, the outcome of the skill, patient's response to your skill, any problems that were noted, and any updates that need to be made based upon that skilled observation and assessment. Similarly, if you were going to teach, or if you were a therapist who was performing a lot of interventions based upon short-term or long-term goals, the system automatically tracks whether your patient is progressing toward your goals, not progressing, or if they've met that goal, and tracks information related to how the patient is progressing or not progressing automatically, again, using those key performance indicators from the assessment. Once you've completed one of those tasks, the system automatically moves it down into the completed section so that you no longer have to complete that. So at the end of the visit, all of your assessments will have been performed so that you know you've maintained compliance each and every visit. The system automatically tracks your medication list as you enter it, giving you alerts for high-risk medications, also automatically tracking drug interactions and contraindications. The system automatically allows you to track communication activity. So if a shift is ending and a patient is complaining of nausea, it becomes very easy to document that so that the next nurse who comes on board immediately sees a condition that needs to be monitored and evaluated for that patient. You can create communication notes, physician orders, incident reports, and other documentation directly from the screen. If anyone else on your care team needs to have a report sent to them, you can immediately do that as well. When you end your visit, you have the ability to capture patient signatures, agent signatures, and have a lot of validation performed. Validation that can be scheduled based upon the tenure of the nurse at your agency. So if you wanted to automatically audit every nurse who has been employed with you for less than 30 days, the system can immediately send that visit note to your auditing team to review. And whereas if you've had a nurse on service with you for years, you can set the system to automatically just spot check some of those assessments. And again, you have all the documentation that you need right here at your fingertips for extra documentation purposes.